Welcome to Adapt NCLEX, How to Pass the NCLEX Prioritization and a Case Study. This is a NCLEX feedback. I suggest you watch this video before you take your NCLEX. Before we get into today's lesson, I want to share something a subscriber sent to me. This is what they said. I took my NCLEX Friday and found out I passed. It was not easy. They had a lot of prioritization questions, intervention, case studies. And what is the subscriber saying? They have scenarios with signs and symptoms and wanted us to tie the disease to the symptoms and the medication to those symptoms. First, congratulations to the member and the subscriber of the channel. This message hit me because what the subscriber described is exactly how the NCLEX is testing right now. So in today's video, I'm going to break down each part of the message. One, prioritization questions, how to approach them. Intervention, how do you answer questions regarding intervention? Case study, how do you approach them? Signs and symptoms, pattern recognition, and what? Medication to symptoms matching. That is pharmacology, but not just pharmacology. Know the symptoms and match it to the medication. I will give you specific example just like a rare exams. So let's get to it. First, prioritization. You know how to do my prioritization. I don't do ABC, neither do I do acute or chronic or age or anything. I go by what we call B sharp. And each word in the B sharp means something. The B is a breathing issue. The E is electrolyte. S is shock or sepsis. H, hypothermia or hypoglycemia. A is what? Airway. R is lethargy. And P is pain. Not just any pain, pain that you're going to lose your life, limb, or eyesight. If you put all them together, these are bad problems. When you see them, you got to be sharp. You say, I got to intervene, or I got to look at it again. Not an expected finding. If this is what I expect in you, I ignore you and I move forward. If you need more, check Adapt NCLEX, and then you master how to do them. Now, I want to show you 4 types of prioritization question, and they get harder as you progress. First one is what? 4-patient prioritization. And this is the easiest one. Who do you see? They give you 4, and you got to figure out who. You have to be sharp. 4-patient. Who I need to see? Well, not an expected finding, but something that is part of the B sharp. You have chronic COPD, and you're requesting Abodrol. What kind of Abodrol? PRN. You should be good, right? Cholecystectomy. Well, I expect you to have pain. What kind of pain? Right shoulder pain. I ignore you. You have pneumonia. You're breathing too fast, and you're using accessory muscle. You are going down the tube. I don't like that. Diabetes, you're hungry. Well, you can eat all you want and you want snack. Good luck. It's not like they are hypoglycemic. They're hungry. They just want to eat. Well, eat everything you want. Therefore, you can tell that number 3 is the right answer. This is types of 4 prioritization patient where you prioritize one over the other based on being sharp and the information on the B sharp. The next one is the priority. This is the single patient where they will give you their problem and you say, what do you prioritize in this patient? You have a patient, his face is burned. They have hoarseness and they have trouble swallowing. What do? You want to treat the wound on the face? Do you want to give them something to drink? This is airway all over it. Facial burn, hoarseness, and trouble swallowing is pattern recognition. That's airway. This patient airway need to be protected. And that's what you should focus on. The third one is a little bit harder. You're anticipating what will happen next. This is risk reduction and what? Physiological adaptation. This is what can break you. This is one of the first point of break in the NCLEX. If you're not doing well in risk reduction and then physiological adaptation, the computer is not going to be happy. So what are you looking for? You're looking for what? Anticipating the worst. If a condition is going to go down fast, that's what you pay attention to. Bronchitis patient, I don't expect you to have fever. I don't expect your heart rate to be 132, and your abdominal is worsening. Condition is going down the tube. We got to do something, intervene. And this is the patient you want to touch. The last one is the hardest one. It's like a case study. You put a constellation of symptoms and you say, I don't like this. The patient come to the PACU. Respiratory rate is high. Okay, do I focus on that? Saturation is 92. Is that the one I'll focus on? His heart rate is 110. Should I ignore the respiratory rate and focus on the heart rate? Patient has incision in the chest. Is there anything wrong with it? And they have increasing restlessness. Put all together and say, which buzzword should you pay attention to concerning to you? Increasing restlessness is what? Hypoxia. Definition of hypoxia. The patient is telling you, I'm not doing well. If you're taking the NCLEX and you see restlessness, it's always a bad problem. So this patient is having airway issue. So that's what you should prioritize in this patient. You see, now let's get to the intervention. The intervention tests a lot of knowledge, content. You got to put things. What do you do next? Right? These are what you do next in the patient. So you have what? 72 hours, right? Patient has TURP, transurethral resection of the prostate. All of a sudden, he's confused, headache, and hypertension. And you say, what happened? When you're doing TURP, it's continuous bladder irrigation. You put too much fluid and irrigate the bladder. In the process, you absorb the fluid, hypotonic fluid. You dilute your sodium, you become hyponatremic, you have confusion, headache, and hypertension. What would you do? A, stop the irrigation. That's what you do. That's your intervention. Don't call the doctor. Stop the poison. Check what? Sodium. And then doctor. Anticipating checking sodium and call the doctor. That's the stages you go through. Don't call the doctor first. You don't check sodium while they are confused. Stop the poison. These are the intervention you should do. Next one, I have chest tube. There's no tidling, but there is drainage in the tube. Well, what is the problem? Then you ask yourself, well, if this is the patient, the chest tube is connected to the patient. And tidling means when they take a breath, there's a movement of air column or fluid column back and forth. If I don't see fluid moving back and forth, patient is not breathing. So the next thing I will do, I'll check if they're breathing. If they're breathing, okay, I'll check for a kink before I let the doctor know that there's no tightening. So those are the things you do by doing what I just described. And those are the answers you pick. Same thing. I ask my patient, you give them albuterol. They're still wheezing. The saturation is 89. What do? Do you call the doctor? Do you give them more medication? Do you do something else? Anticipate that if you give them more albuterol, it's not going to work. Go up. They may need steroid. They may need magnesium. They may need what? Epinephrine. All of this is what you do. So anticipate intervention that you should do. Don't keep on giving albuterol. Now, you know DKA. Glucose is 560. Cushman breathing. Dehydration. Well, what would you do? Then you go with your content. You say, I know that the reason why they in DKA usually type 1 diabetes, they don't have insulin to push glucose inside the cell. So the body cannot use glucose. Therefore, body use what? Fat. It breaks fat into ketones. And therefore, Cushman breathing. The glucose build up and it lead to osmotic diuresis. You get dehydration. If the glucose build up, you have that. What do you want to do? They came in because of what? DKA. Why do you think the number one thing they came in is because of dehydration? Therefore, what will be your number one thing? Give them fluid before insulin. Then you check their potassium and then their glucose. This is what the NCLEX is testing. Your knowledge related to the concept. And then you can figure out what to do next. I know you master it, and I know you got it. Now, let's go to the case study. The case study tests your critical thinking and putting things together. It's called pattern recognition. And how do you read it? The first two sentences of the case is where most of the information is. And I call them buzzword. They will put it together. And you say, oh, if I connect dyspnea, crackles, pink fluid sputum, and saturation of low, something is telling me what is going on with this patient. This is not asthma. This is not pulmonary embolism. I see crackles, that's fluid. I see pink fluid sputum, that is pulmonary edema. This patient is in CHF exacerbation. You see how you connect it. And therefore, I need to manage this patient appropriately. They're going to ask you, what do you do with this patient? Well, CHF exacerbation. What is the priority? Give them oxygen. What intervention? Get rid of the fluid. This patient will need furosemide. Which of this is concerning? Which buzzword? Dyspnea, crackles, pink fluid sputum, saturation, and blood pressure. Put it down in the comments and let me know which of that 5 information will be your priority concerning. I can tell you, not the dyspnea, not the crackles, not the saturation. Pink fluid sputum. Pink fluid sputum means they're drowning. They have pulmonary edema. This is what is going to kill them. Therefore, that's my priority. That's how you approach case study. Another one, you smell fruity. You have Kushner breathing. Your glucose is high. And you have potassium. Oh, glucose is high. You start using your fat to make ketones because you have no insulin, and your potassium go high because you can't push potassium inside the cell. You have metabolic acidosis. This is what? DKA. Therefore, what would I do? We talk about it. Fluid, fluid, fluid. Which one will you monitor? Potassium, potassium, potassium. How do I know you're improving? Bring your content. Bring your content. It's called DKA. Well, diabetes, your glucose should be normal. Keto, there should be no ketones. Acidosis, there should be no more metabolic acidosis. While you have Kushner breathing, you're compensating for what? Metabolic acidosis. That's the way you should approach the case study. Now, excuse me to say, this is the problem that killed a bunch of people. This is what I can tell you is going to be exactly why you fail or pass. Signs and symptoms and pattern recognition, because the NCLEX does not want you to memorize, they want you to connect the dots. And if you know signs and symptoms and pattern recognition, case study will become easy, prioritization become easy because you're using buzzword. I want you to pay attention to this portion. When you're studying, pay attention to signs and symptoms. They are pattern recognition. What do I mean? I give you a patient who has aphasia, inability to speak, right-sided weakness. Put down in the comment and tell me one thing that came to your mind. Patient has ptosis, weakness, worsening with activity, and they're strong during the day. Tell me one thing that came to your mind. Patient has hysteresis, he has confusion and elevated ammonia. I would like to know the first thing that came to your mind. Pattern recognition, signs and symptoms. I have a young male. He has what? Chorea movement. He's moving like a snake and cognitive decline. This is what they will put in the first 2 sentences of the case study. That's your buzzword. That's your diagnosis. That's your signs and symptoms pattern. Right upper rampant. I have nausea. I have what? Fever. My white count is elevated. What is going on? I would like to know what you're going to put for these kind of conditions in the comment. And patient just has TURP. They have confusion. They have irritability. What are your diagnoses? Symptoms and diagnosis. Diagnosis and symptoms. They go hand in hand. Number 1, it cannot be Bell palsy because you have weakness on your body, just not your face. You can have inability to speak or aphasia, but you're not going to have right-sided weakness. Therefore, this is stroke. Ptosis, well, and you have weakness, what? Worsening with activity. When you're stronger during the day and you get weak later on during the day. This has all Myasthenia gravis written over it. Pattern recognition, 3 words, and I've told you what Myasthenia gravis is. I have hysteresis and I'm confused, and my ammonia is elevated. Connect ammonia and hysteresis. Hysteresis is what? Flapping tremor. That is what? Hepatic encephalopathy. These are keys. You don't need a bunch of sentences. These 3 words should make you make a diagnosis. And if you have a young guy, you're walking like a snake, and you're having cognitive decline, hey, that's Huntington's disease. If you have right upper quadrant pain, your white count is elevated, you have fever, nausea, cholecystitis. After TURP, and you confuse your irritability, hyponatremia. I know you got it. I know you get 6 out of 6 because you want to adapt NCLEX. And this is what I want you to recognize, be comfortable with, be able to answer them without any problem. So those are the things NCLEX is testing. Now, pharmacology, they don't want you to just memorize pharmacology. They want you to be able to connect it to the dot. They can give you signs and symptoms, and you can figure out what medication will do that. Number 1, you have nausea, vision changes because you take some medication, and you see yellow arrow, and you have bradycardia. What do you think? Which common medication would do that? Common top medication, NCLEX will ask you. I have a bunch of videos about 40 tops, 5 you have to know. A bunch of them, pharmacology. Watch Adapt NCLEX. And if you take a medication, that give you tremor, confusion, seizures. Which one? The most common one. You have muscle weakness, dehydration, and arrhythmia. Or common medication, the NCLEX will ask you will cause that. Drooling, and you have risk of infection, and you have weight gain. What do you think? These are the options. Match them. Tell me which one will do that. Put your content together. And if you need more, check Adapt NCLEX. A bunch of pharmacology video to help you master this. But I'm going to help you. This is it. Clozapine, antipsychotic, because it's drooling because you have too much hypersecretion. Agranulocytosis, risk of infection, because it's weight gain, hyperlipidemia, diabetes. This is your problem. Muscle weakness, low potassium. Dehydration, you're losing fluid. This arrhythmia, because your potassium is low. Furosemide, all over it. And you have seizures, you confuse, you have tremor, probably you're taking lithium. Bradycardia, because what? Digoxin, I tell people, draw a caricature. Start from the head, confusion. Go with the eyes, halo changes, mouth, GI symptoms, heart, cardiac problem, and then your kidney. Well, I see halo, I see GI symptoms, I see cardiac problem. That's digoxin. This is what the NCLEX is testing. This is what they want you to know, and this is what I want you to pay attention. Stop the video. I want you to rewind it so you know this strategy. Really wanted to share based on the comment I saw. And if you're taking your exams in a short time, I want you to watch for it. Therefore, to you, the subscriber who passed the exams, congratulations. And thank you for sharing exactly what the NCLEX is looking for and what it look like. And to everyone watching this is how the exams is being tested. Right now, prioritization, intervention, case studies, symptoms pattern, medication symptoms matching. If you master this, you will do well. The NCLEX is beatable with this strategy. This is how you pass it. Know the type of prioritization. Know when you're supposed to intervene, and the next thing you do, how to read a case study. Pay attention to the buzzword. Connect the symptoms. You don't need 50 symptoms to make a diagnosis. Key ones. And then when you have a medication, pick 3 things that will let you recognize that medication. I want you to put ready if you're going to take your test this month or in the next few days. And subscribe to Adapt NCLEX for more content, 85 questions, NCLEX practice questions, high yield fat pharmacology. And watch for the 85 questions, it will be based on this strategy. Take care of yourself and good luck in nursing school and for your NCLEX. Bye-bye.